So we'll just take a second to let everybody come back in. We might as well.
Well, already, it was my niece Alice's birthday today. She's right here. She's for sure. She's 40 years old. I was in second grade before. I was in shape at night, baby. But she's on first knees. Because I had nephews already, and I have people and sisters, but I still want to have these. I'm so sorry.
All right, guys, we are going to get started with the topic of menopause and all its gifts. And for all, as I see a woman sitting there fanning herself, let's just say there's an electronic one right there. Turn it on, and you're on. We're going to get started with a great panel of experts. You'll recognize Dr. Somi. She was on our panel of How to Stay Healthy, and she's going to be talking about menopause. Or do you want to do an introduction?
Sure, and I also want to thank ONS because they're sponsoring this. So you're going to hear about ONS and
there's a little gift here.
So I'd like to Dr. Elizabeth Fisher. Yes. And Dr. Fisher, pleasure you yesterday, so excited. And she is a double board certified oncologist specializing in surgery and all. Thank you. Here, special oncology, laser acne, hair loss, all the things, yes. And then, looking at over a while ago, yes, Sally Mueller, she's been a guest on the podcast. We've got different things that you had. We're going to graduate tomorrow. Yes, she's co-founder and CEO of Woman Nest. So she and her partner, Michelle Jacobs, created Woman Nest and is modernizing aging for women. So we're going to find out all about Woman Nest and products and everything about.
And really that it's a line that is so needed that we were taught to find it. How many times we say to the doctors, you're second class, and you go from diapers to depends, and there's nothing there's a lot of change. And we see ourselves on those shelves. So Woman-S is a brand that is very easy to find. We're going to talk about that whole line of products, including vibrators. Yes, we will be talking about the Sahara Desert. Just get ready. Speaking of Dr. Somi gets to start. But I'll start saying that. There are a lot of women who hear the term menopause and they don't even know what that means. They don't know what they are. Before I started this period, I think when I was in period, why I was period, and I noticed. So we could just get started. Could you explain what menopause is, what perimenopause is?
Absolutely. So menopause is 12 consecutive months without any bleeding. It has documented 34 symptoms from head to toe. So hot flashes, vaginal dryness, insomnia, joint pain, dry skin, problems finding your words, anxiety, depression. It really passes from head to toe. The average age in the United States is 51. Perimenopause is its evil twin sister, and so it can have everything the same, all the same symptoms, because people are like, oh my god, this is just peri, what's going to happen to me when I actually move into menopause? Probably the same thing, but the only difference is in perimenopause, you are still having some degree of bleeding. It may not be regular, it may not be like clockwork, so they are very, very similar, and like I said, perimenopause can precede menopause by up to 10 years. So yes, it can start in your 30s for some people. Post-menopause, people get so excited because they're like, I'm done. No, it doesn't mean symptomatic, we know that someone who can be symptomatic without treatment for up to 20 years. We, as doctors, use menopause and postmenopause very interchangeably. When we have a woman who presents with bleeding in the menopausal period, we want to make sure there's not a fibroid polyp, God forbid, gynecologic cancer. So we make a very big distinction between perimenopausal bleeding and postmenopausal bleeding. So those are the definitions. I'm sorry, fascinating.
And you know, for a lot of them, they say, well, I'm in menopause. They don't realize that menopause is one single day of 12 months, no periods, no nursing, and go to post. And that doesn't mean that your symptoms go down. And what about Bridget is going to ask you questions about condition about skin.
So we move this about, you know, that you have a we're all inundated. It's really sad. You know, we all like we do this, but so stop. We're all doing it right now. And so what ingredients do you pour all the process and products with skin product today? And what is something that is really not good, and what is something you should look for when you're just wanting to just take care of it? It's not necessarily trying to reverse the thought or anything.
So I want to share a little bit about my background. So I did 3 years of internal medicine residency, always knowing that I wanted to be a dermatologist. But your skin is your largest organ. I can tell your health and wellness based on looking at your skin. So when I look at treatment patients, not a single patient ever comes into me saying, oh, I want to look 10 years younger. They all say, I just want to feel better. I want to feel healthy. They want to be the best version of themselves. And I have never said that feedback because that's a market employee. If any physician says, why are you making 10 to 1500, run the other way. I never have that conversation. Why? How can you depends on so many things. Your genetics is number one. Whether you like it or not, you look like mom and dad, you age like mom and dad. I like to see pictures of you over time. Why? I'm looking at you as a physician with my eyes, and then there's an art to you. There really is. I always say to patients, you have to find someone that shares your aesthetic ideas. What do I mean by that? I have a certain aesthetic that I like. You and I have to match, and I may not be a good match for you, and that is okay. And I share what my ideas are. Over time, you lose bone, by the way. This is not just during menopause. Over time, slowly and surely, you lose your bone, your ligaments elongate, that's what causes these folds. So I'm not chasing imperfections when I see someone. I'm looking at you globally. I'm looking at your scalp, I'm looking at your skin, I'm looking at your body, I'm kind of scanning you. So when you say what are products, it is such an intimidating thing when you go into, have y'all got into a Sephora or an Ulta? I'm a dermatologist. This isn't my field. This is what gives me ways to figure out products and learn new things and science. So how do I pick products? I'm going to tell you how I do. 3 things that I noticed. The actual ingredients in the product. I look at every ingredient to see what's in there. Number 2, is there actual evidence-based research with ingredients all together? You have to be very smart inside. When I'm investigating things, sometimes in studies, and by the way, to get the FDA to approve something to say it does what it does, is years of trials and evidence-based research before it can get FDA approval. So you look at that, and let's be real. Does it work in the real world? Would I give it to my mom? I want to use it. So I test out everything. If I partner with a brand, if I partner with a skincare company, guess what? It has to work because that's my name. That's my reputation. I've done 2 residencies, 2 fellowships. I'm not going to tell you something works if it doesn't. So you have to align yourself. I think in the US versus overseas, dermatology has to be accessible. What do I mean by that? Dermatology shouldn't be a luxury. It's skin health and wellness. so, I love social media, I hate social media, because it's good and bad. Dr. Google, I disagree. So everyone has an opinion on Dr. Google, and I know who you are, because when you come to my clinic, but I read, that's what you're doing, that Dr. Google, so my staff has a mug for me that says, my MD is better than your Dr. Google degree. And I have it on my desk. And it's so true though, and I get it, you're trying to educate yourself, you're trying to learn, I don't see anything wrong with that. My best patient is a well-informed patient. Come ask me some questions, come in and let's have a discussion, because it shouldn't be a one-way street, we're having a dialogue, this is about your care. And so there are a lot of products out there, less is more, you don't need a 12-step routine. I use about 3 things and maybe 3, I'm not a good patient by the way. If you ask, I'm not going to follow the instructions, doing anything, so if you ask me to do something complex, I just have to work out something. So you need a basic cleanser that's targeted for your skin type. Number 2, what's your issue? Do you have dry skin? Do you have rosacea? Do you have eczema? By the way, acne doesn't end when you're a tree. I feel good, but you have to be sort of understanding that. So you have to pick and target products in a dark spot for you. Not for your friend, not for what works for your neighbor down the street, because there's so much skincare out there. And I will touch on some of the ingredients in the next question.
Now, Sally is co-founder of Luminous, is a line of products for menopausal women. And, I kind of question whether I should put you on the Boss Ladies panel. In this panel, you should really could speak on the lot, actually, but you found an area that a lot of us struggle with, which is finding products that address our needs. And I said, you know what, I'm going to do something about it. Can you talk about the way products are changing now, how that's going to be, and why it's so important to find products like this in Target and online and things like that? Obviously, woman is really because of personal experience, but it wasn't until skin changed, dryness, sleep issues, all these issues kicked in, and the kicker for me was at a doctor's appointment, the doctor gave me a list of products to buy on Amazon, and I looked at that list of products, and I thought, oh my gosh, I was spending my whole career building brands for women, and I just created a sleep program. Why am I not creating a whole line of menopause products? It was just this moment of we deserve better, and we need to have clean ingredients. We need to, have language that doesn't speak to anti-aging. We need to have a brand that educates you, that has a community. So that was really the impetus behind the whole brand, which I created. But it was such a wasteland of products out there. This is like 5 years ago. And there were clean, like I said, clean formulations that were made with really, really high quality ingredients. And it seemed like all the new innovations happening for millennials. So again, we deserve credit. Yes, we do, and you can go literally, they have everything. They have lubricant, they have face cream, they have a thing called that snack, which is really good. So they roll your under eye.
I'm on subscription to that. And I have to say that it's in stock.
It's good.
So
It's a patch.
it's a patch. And they got this really. Sure, where it's sold. I mean, I know they have a website.
It's wellness.com, Amazon, and ultimately that's they have just rolled this out to another 500 stores, so almost all the stores. There's like 1,350 or 1,500, so
So they've been just really, really incredibly supportive. And I think that's been another reason. The retailers are so behind, really catering to our needs. There isn't a section in retail that's for women's health. We talked about the walking to the Depends aisle or the diaper aisle, and it is truly like that pause. It is in the stores relegated to the bottom shelf. And it's just so disappointing. So we really embraced all the beauty and they've embraced us because they really believe in celebrating this bigger world. And they know that this will go on, all of us going into all the beauty with our daughters or nieces and shopping. And it's a cross-generational experience. So kudos to them for really being behind us.
And it's so important that we see ourselves on the shelf. You can't always get to a doctor, and maybe the doctor is in 3 weeks and there's something over the counter that might actually be helpful. So it's wonderful to see those brands. So many. Let's talk about them. Okay? Because there has been so much information. We all know that there's been bad information, good information about hormones. For women who want to talk to their doctor about should I be taking hormones? What are the important questions that they should be asking?
So I just got back from Menopause Society, formerly known as NAMS, and a really, really exciting thing is for the first time in 20 years, I'm actually seeing my colleagues excited about hormones again and wanting to learn and prescribe again. So, you all read that New York Times article. We've done such a good job as providers and the press and society about not discovering myths about hormones. Are they for everybody? No, but they're a lot safer than what was shared with everybody. The study was not designed ideally. It didn't look at transdermal estrogens, which are what we prefer through the skin. And it included women 70 to 79. And that's not the target audience that we normally treat with hormones. And so now, the party line is hormone therapy, when appropriate, is a great thing, not only for all of the symptoms of menopause that we feel, insomnia, cognitive decline, but the invisible symptoms too, right? There's no other drug, there are other drugs that are available that have the efficacy to protect your bone, to protect brain, to protect your heart. And so you see data really coming out, and the problem with the WHS study was that a press conference was called, right? And they said, we're stopping this study. The study was designed looking at, let's look at the cardiovascular benefit of estrogens and estrogen and progesterone. But it was only one arm that was causing the problem, and it was a really small problem. If you actually looked at the women on estrogen, they had a 30% decreased risk of breast cancer. They had 30% decreased risk of overall mortality, and the women that got breast cancer in that arm were less likely to die from their cancer. And no one ever called the press conference to talk about all the great data we have learned since 2002 about the brain, about your heart, about everything else that hormones can help with. And so, really, there's now a movement to not only educate our patients, but to educate ourselves about hormone therapy. So that was really, really exciting. And then there was a lot of talk about cancer and whether or not patients who have cancers can be on hormone therapy. And, I talked about mutual decision making. Yes, data is showing for certain patients, even if you have cancers, depending on genetic testing, everything, there's a potential to get on hormone. So even the patient populations where we thought it's absolutely forbidden, it's not true. NAMS put out a consensus statement about testosterone therapy, the forgotten hormone for women that helps with all of the domains of sexuality, libido, orgasm, desire, moisture, satisfaction. And so there's a lot of exciting outcomes and innovation. We talked about radio frequency and microneedling in the vagina, not to make people have a younger vagina, but as an intervention for genital urinary syndrome of menopause. So the dryness, the pain, having to go to the bathroom every 5 minutes. I was also racing to the bathroom. But all those collective vaginal and bladder symptoms, and we got to present our data. And I'll tell you, 10 years ago, they would not have wanted me to present such modern, forward-thinking data. They would be like, no, we had 90-95% outcomes. So a lot of exciting things happen in the hormone space.
And the fact that it's getting out, the information is being sent out, because a lot of women say they're practitioners, who are simply not educated around the products. And I hear the word just post. If you're in a doctor's office and they say to you, it's just menopause, I need to know. It's not just.
If they're not offering you any options.
It's affecting your life. If it's affecting your ability to function for the day, I mean, virtual setting, but 10 hours runs
I really
a day.
And I'm looking at those two who didn't have any of those sisters, and my sisters did, and really badly, and I really was, and I've been to an oncologist, this is probably, oh gosh, 8 or 9 years ago, and would not put me on hormones. First of all, they believed that I was very, because I think it was like 11 months out, and then would not do it, would not at all consider putting me on Effexor. And it didn't help at all, and they were very hesitant to put me on hormones. Finally, I found a different doctor that did, and they worked wonders for me. I know it's not for everybody, but they really used to be stop. Yeah.
I mean, there's 26 options for men for sexual dysfunction. 26 FDA approved options. And Viagra was honestly emergency use authorized in 6 months. So erectile dysfunction was a national emergency. Sexual health drug, took 6 years. We never think twice about asking a man about quality of life. But for women, when I went to the FDA, then of course it's low libido and I'm like, well, maybe they're going to use a relationship. Rapid treating menopausal symptoms is costing the U.S. economy right now $1.8 billion because of lost work. 900,000 women in the UK left the workforce. Like they were talking about, we're in the prime of our lives. I'm 48, I ain't going anywhere right now. So I don't want to not be able to be treated and not have a relationship, not be able to work, not be productive because someone's not diagnosing me. Now, that being said, hormones are not for everybody, and maybe because of a medical problem, or maybe choice. Maybe you're like, you know what? My mom had it, she got breast cancer, I really don't want it. There are a multitude of options over the counter, prescription, non-hormonal, vibrators. We talked about vibrators at
We tried to get one of those for the friends. But you do have around some serum.
And there's updated group medications for sex drive for women. There's digital therapeutics. There's 2 apps where you can either listen to erotica or read erotica. And it's evidence-based. You can help you with your sexuality. So even if you're like, I'm a hormone, or maybe I don't want those 2 medications, Addie and Vitamin C, because people always ask me different. Non-hormonal. Okay for patients who have cancer, okay for patients who are in menopause, and you guys will look it up and say, it says it's not indicated. So the difference between indicated and contraindicated just means the FDA didn't slap the label on it because you have to pay for yet another study. But it's okay, we have tons and tons of data in those patient populations with medications. So you have a sex drive, you don't have to overdrive, you don't have to be on this
I went to her MD, and I went to her MD and I was prescribed testosterone, although I didn't have to get it at compounding pharmacy. So can you share what's going on with that?
Yes, so there is only one country in the world right now that has a testosterone product for women. It's Australia, so they're a little bit ahead of us. But even though there is a global consensus statement supporting testosterone's use, all of us who go to LabCorp Quest, major laboratory, and I'm trying to buy something, we all have a testosterone level. We do. And testosterone has been proven to support all of those domains of sexuality that I'm talking about. So your sex drive, your orgasm, everything. And yet in the United States, we do not have a testosterone-only, FDA-approved treatment option for women. So how do you get testosterone? You use milk formulations, we can compound it for you, or you can use pellets. The problem is a lot of people who should have been prescribing it were. And there are amazing side effects from testosterone for sex life. But then you don't want to go to OT and have to go to you and go to therapy.
I'm actually anti-drug because in Dallas, on every corner is a tea clinic. And who's running the tea clinic is a provider, not a board certified endocrinologist, not a board certified anybody. And I'm seeing, so what did I say? Horrific steroid acne on the chest of the temple, molding, nail pattern, molding, and hair. It is awful. And so, but to tell that person, permanent energy, they're doing all this other stuff, but to then wean them off is really choppy. It's dangerous. We're putting people at risk.
It's
So,
dangerous when it's supra physiologic. So fancy word for we know what levels and what we use to do. And that was the problem, that people were dabbling where they should not. And so that's why you need to go to a reliable provider who knows what they're doing, who will measure your levels and make sure you're not undertreated, but not overtreated. And so that is the goal of testosterone therapy. And we're hoping later this year, it's expected that there is going to be a testosterone patch going into clinical trials for women in this country. That's good.
so we all passionate.
So the reason I like milk formulations are expensive and they're very hard to titrate.
It's like 1/10.
Yeah, it's like a tenth of what men.
It's like you really talk before. I learned that somewhere. So, we talked about testosterone, but estrogen. As we start to lose estrogen in our skin, and it starts to dry, and it starts to get dark patches, what can we do, and how simple can it be? Like, if you look at the counter, there's 10 different products. Do you really need those? No. So I'm so happy that you asked that question because it's simple. Your estrogen levels are, falling down. Your cortisol, which we don't like, is going to be high. Cortisol, we know, is the stress hormone. Everyone in here experiences stress. So what can we do to tackle that? There are things you can do topically. We all know about your diet, your overall wellness, exercise, and it doesn't matter. What you put into your body really is going to impact your skin as well and your overall health. But it's very simple. So I like to look again when I'm looking for products. I told you the three things I'm looking for. But I also don't want products that don't have true science and backing. So when we are dermatology residents, when I was an internal medicine resident, I don't remember ever having a discussion about menopause at all. Remember, that's the whole body. You're supposed to be graduate out in medicine as well. When I did dermatology, there was some discussion. In 1992, Restream, which is the brand that guys are going to get to try, did one of the first studies specifically looking at skin changes with menopause. So not now, 1992, 30 years ago, and they had done with over 1,500 patients. They had 30 published studies. The most recent was in 2022, and looking at it, they have a whole product line that is meant for post-period and postmenopausal women. And remember, menopause, that's the average age in the US is 51. But I hate that we label people by age. Remember, someone may experience this in their 30s. And if they don't know that they're to expect that and what the symptoms are the symptoms? Usually most people, dryness is number one. But they say, well, my skin just doesn't really is that luminosity has a medical reason. When you're younger, your skin cells turn over. Keratinocytes, which are that top layer, are not turning over as we age. So what do we do to make it turn over? Is your barrier. Your skin barrier. Remember, your skin is protecting all your organs, and it's the largest organ. So what do? I try to optimize your skin barrier. What ingredients am I looking for? This product line has some of the key ingredients. Hyaluronic acid, which is critical. Why? Hyaluronic acid draws in moisture and water, hydrating the skin. You know that dewy, glowy look that everyone wants? Hyaluronic acid and lipids. Lipids are a good thing for the skin. There are different types of lipids. You want lipids liquids that are non-comedogenic, that are not going to break you out and give you acne. So that's important. And antioxidants. There's a specific ingredient in this called cassia extract, which again, done in formulation with something called oxaline, with issues of volcanic waters. If you travel in France, they're very lucky because they have these sources where they have these special waters with minerals. I use those since I've been about 18 years old. Not specifically this one, but I have very dry, sensitive skin. So keeping my skin hydrated is key. You don't have to have eczema, you don't have to be in menopause. If you have dry skin, you need hydration. So this line has a serum. Serums are liquid based, they're not a cream, so you can put that on for discoloration, fine lines, the dryness, that itching. And then there's creams. They have one for perimenopause specifically with different ingredients. It's densifying, and then they have one that's replenishing for postmenopause. So they really, and again, it's not like they say, oh, no. They've done the research and the studies, they've looked at the collagen, the elastin fibers, taken punch biopsies. That's when you take a tool, take a sample of the skin that's been treated, and then they look at it under the microscope over time. So there's actually really good science behind it. And so that's 2 steps. You're gonna wash your face, put your serum on, and cream as needed.
And the same goes for your vaginal health. Those same things that you're describing are going on in the vagina.
The skin is from head to toe. That is mucosal tissue. So lips, vagina are all mucosal tissues. Skin is a different type of tissue. They're all tissues.
So some women, when they think, oh, I'm on a patch, or I'm on a pill, or I'm on a spray, I don't need anything to treat my vagina. Those women still may need a vaginal estrogen or a DHEA, there's Rosa, which is available by prescription and usually covered by insurance, that helps with collagen, elastin, blood flow, dryness, sexual pain, and can even help support bladder health. So there are sometimes women who are like, I don't want full-blown systemic, like it going into the bloodstream hormone therapy, but we still put them on localized estrogen or localized hormone. But for other problem in this country with the FDA is the package inserts for full-blown hormone therapy and vaginal therapy is still the same, and it's incorrect. It shouldn't be because you're not nearly absorbing the same amounts. And so it really scares you because you're going to treat your dry vagina and you're reading that you're going to get dementia, heart attack, and stroke. And it's just not true. And I was at the FDA once and I was like, when is this label going to change? And they were like, watch me. So, that's the truth. And so I tell my patients, I educate them, I give them this kind of analysis, I tell them what they're going to be, and then I'm like, yes, you should read it, but please be aware that it is not accurate. It's not the same as full-blown hormone.
I was going to say,
I just wanted to mention that these 2 products that you mentioned are the Perry, the serum, and the Ghost. So have fun with that. Let us know. But yes, it's all
right. I was just going to say, Sally, so one has products as well. So can you share some of the products as well?
We carry supplements. One is called menopause, which is an all-around menopause supplement for sweats. As you mentioned, so. And we use a clinically proven ingredient called Pinagenol, which is a very high dose so that we can reference the clinical studies. And it's been known to really lessen hot flushes. So if you've had breast cancer or cancer in your family and you're looking for something safe and over the counter, that's a great option. We also have Love and Sleep for sleep, which has a kind of release melatonin. We have active growth for your skin and joints. And all of them have clinically proven ingredients. And then, much like Elizabeth said, our skincare is very streamlined. So we have 8 skincare products. We have, and all of them use advanced hyaluronic acid called medication. You know, something to add. But it's really built for extra hydration. So again, it's very streamlined because you don't need that many products. You need a great concept, which you have a great serum, and moisturizer. And then we have 3 sexual wellness
I should have gifted all of you a vibrator.
So
no,
They look like lipsticks, by the way.
Yeah, they look like little
Yeah.
lipsticks, but next year we'll definitely give her a vibrator. And then they ask you for that moisturizers because as your skin dries dramatically, you know, not just your facial skin, but your all of your body skin. And we have one that's coconut based, one that's bliss, and then one that's water based. So everything is affordable. For one is $46. And that was really important to make sure that the way we choose that is possible.
And you're educated, it's not just the products, you go to the website, there's a community, like we said, throughout this event. It's about community, it's about conversation, you can ask your questions in the very beginning, Sally would answer on the questions and answers that have. That's me. Remember the very beginning, you had like.
Oh, yeah, we did.
You were on the
Question and 17. You and Ashton.
Yeah.
But I wanted to ask,
I just
Dr.
wanted to make sure.
I wanted to ask Dr. Restream about hair loss.
So
Yes,
happy.
because I heard from so many people about hair loss, and if you talk about hair loss at this time.
It is with pleasure that I speak about hair loss. If you know me, it's one of my favorite things to treat and really love it. Why? When you come in, and male or female, but especially for females, when you have your hair that's thinning and your quality, your part is getting wider, I call it the ponytail test. Instead of 2 loops, you're at 5 loops, that means the hair is thinning. You see tons of hairs in your shower room, in your home, it affects your self-esteem, how you present at work, in your personal life. It's a challenge, and hair loss can be from so many things. Think of it from a woman's perspective. You get your period, you may have babies, you may not, you're taking some form of hormone contraceptive pill. Then you get into the workforce, you lead a stressful life, you're starving because you're on some sort of diet, you're on a protein diet, high fat, low fat. It's a constant fluctuation over time. And so as a female, and one who really beautiful hair is important. So what can we do? Get in early. So I set up during COVID a whole telehealth platform to allow access to people to have a consult to talk about these things. Because you're right, it's hard to get into the dermatologist. And you're booked out that you can do telehealth, send me what the zip code is, and tell you who I'm coaching. Because not everyone that is a dermatologist wants to do hair loss. I'll be honest with you, we can do from pediatric to geriatric. Some people do surgeries only. Just like any other specialty, people have their various things in life. Hair loss is very complex. Why? Your hair is not essential. What we're going to do, your body allocates its nutrients, its hormones to things that are essential. Hair technically is not. So if your body is so stressed and there's cortisol level, this gets going first. Your hair. So what do? I do a thorough panel of blood work. I do a full evaluation of your scalp, your symptoms, how long it's been going on, medication history, surgical history, because you can have different things. The most common thing that I'm seeing are 2. Androgenetic alopecia, which happens with normal aging. Number 2 is something called telogen effluvium. With COVID, with stress, with a move, with a new job, with surgery, the hair sheds. It's pretty frightening. The good news is the hair usually comes back. It lasts up to 6 months. So what can you do? See someone early, get your blood work done. Most women are deficient, including myself, in vitamin D3, zinc, selenium. There's iron is another big one, by the way. And so you want to make sure that you fix that first. There may be a physiological reason for your hair loss. Number 2, don't be scared to wash your hair. And you're going to look at your why she's saying that. There are all these things on social media about scalp training. You cannot train a scalp. You can wash your scalp. This is dead. What's healthy is this. Your scalp health is critical. You have to have a good environment for your hair follicles to be able to grow. So wash your hair. Don't be afraid of washing. It's normal to lose about 50 to 100 hairs per day. Vitamins, the one that I stay away from, which I think has the best publicist on the earth, is biotin. I don't know your hair. Stop taking bites. It can actually be bad for your laboratories. If you have thyroid disease, when you go to get your labs done, that can alter it. If you are a female, as you said, with your mom, that can alter your cardiac enzymes. So if you, God forbid, have a heart attack as a woman, you go in to get your labs done, the biotin is going to cause an alteration. So what would I take are the ones that I mentioned. I do think there are some good supplements over the counter. I love something called PRP, rich plasma. We have a lot of good research that's evidence-based about that. I'm a big fan of that, and it works. It clinically works. So don't give up. If someone tells you, oh, just go take some biotin, it's okay, it's normal. It's not normal, and we can help. There are many things we can do to help you. Don't give up. Now, I will be honest. One of the things I tell people is I would never be a male or female hair when you're 16 years old. When I was 16 years old, my hair was a one-hoop ponytail. It's still pretty good hair, but it's not a 16-year-old hair. So if someone tells you that, it's setting an expectation of being honest. But we can help you, and we will not we can do because think about it. Your hair, really good hair, you just feel better. You do, I think so. Definitely, we can help you.
You know, I'm so glad you said the thing about vitamin, because I was thinking about vitamin, and whoever, there's none of them back there, in my liver enzymes. I mean, I had to have a liver fibrosis test, I had a liver ultrasound. There was nothing wrong with it, but the liver enzymes were high. But taking that, the liver enzymes are high.
I will say one thing though, on most commercially available products right now, there is some component of biotin for very low vitamins. You can't, so if you're going to go get your liver, wait about 10 days. I myself went to go get my thyroid panels and I forgot that I was taking something. The labs were wonky. I was like, oh, I forgot. And so then I told the doctor, I was like, oh gosh, I'm on this, so can I come out? She's like, oh, fine. But no one tells you this. If I didn't know, no one tells you. So again, it's not going to harm you in any way per se, or it's not going to make your hair fall out, but it's not helping you. If it's in one of your vitamins, just stop at least maybe 4 days before you go get your blood.
And I just want to remind you also with Womaness, there's a vitamin C serum. So make sure to check that out as well. The front, when you open up not the program, but the booklet, you will see emails and websites.
So I have to say, I actually communicate better on there than an email. It's at PushMD, like my own last name.
And you have a pen.
So you have your hot flashes and cold topics in, you can write that.
So, you know, if you have questions, obviously this is being live streamed and it's also being taped. We will have it up on our YouTube channel, Hot Flashes and Cool Topics. So if you have questions, you can watch that again. But use the emails. You know, you can always email us and we can connect you with someone who can help, because obviously Rich and I are not the experts, but we talk to the experts. So we are happy to give you the connections. Just email us. Follow up. Don't forget, if there's something that's resonated with you here, follow up on it. Don't just write it down and forget about it, because it's your health and it's important. So we would like to thank Sally, our person, who's Cindy Skincare is out there. We're going to talk about hair, skincare, and Vichy is out there as well. And Johanna can answer any of your questions on that. So we'll see you guys in about 15 minutes.